Today we are studying about malignant melanoma. Malignant melanoma is a disease of whites. It is neoplasm of melanocytes, obviously, and it is third common cancer of skin. Now, if we come to the etiology, what is the etiology? So, sun exposure, long hours in standing in the sun or anything like that. Then you have higher economic status, socio-economic status. If you're high, you can have it. Fair, red hair, and freckles. The people who have fair skin, freckles, and red hair, this phenotypic people are usually more prone to have malignant melanoma. And then artificial UV exposure, familial melanoma or xeroderma pigmentosum. The people who have more number of melanotic nevi. The pathogenesis is two-phase growth hai, radical and vertical. In radical, what happens is that whenever a cell is used to penetrate the basement membrane, the immune system of the human body is used to kill them, or necrosis, apoptosis, whatever you want to say. It is an initial phase and may last for many years. In this, the cells shed like mature epithelium cells. In vertical, it happens because either the virulence is more or the immune system of body is downgrading itself or whatever. In vertical growth, there is more chances of metastasis, and it begins with populating the connective tissue. Clinical features are based on the type of malignant melanoma. First is superficial, which have brown, black, and tan admixed color. It is 65% of the cases are superficial only, and superficial due to sun exposure it is. And then we have nodule, which is vertical growth is seen more than radical, and it is 13%. And then we have lentigo. Lentigo is one more thing in that nodular, it has black or pink color. In lentigo you will see on sole and palm. Sorry, lentigo you will not see in sole and palm. Lentigo is radical growth. So first one was superficial, it was superficial. Second one was vertical, this is radical. You will see radical growth, and it is macular lesion. In acral lentigo, there is it is on sole and palm, and it is macular lentiginous pigmented area around the nodule. Extremely aggressive, and it may also ulcerate. Mucosal lentigus is on the mucosal epithelium, and there is a melanotic, which is erythematous or pink nodule. So let's revise. Superficial 65%. What happens in that is brown, black, or tan colored skin nodule, and it is because of sun exposure. Next is nodule, which is pink or black. Vertical growth is seen more. And then we have lentigo. Lentigo is macular lesion, and it is radical growth. Acral lentigus has macular lentiginous pigmentation around the nodule, and it is on sole and palm. Then we have mucosal lentiginous, which is on the mucosal epithelium. Then we have amelanotic, which is erythematous or pink pink color. Then we have the criteria for diagnosis, that is A, B, C, D, E. A is for asymmetric, B is for the border is irregular, C is for color irregularities, D is for the diameter should be greater than 6 mm, E is for elevation. If you see all of these characteristics in a nevi, then it is, you know what. Histological features: when cells nest and clusters are organized in a are grouped in a fashion which is known as organoid fashion. The melanotic cells are distributed epithelioid melanotic cells are distributed among the epithelium in a pegatoid manner. The pegatoid spread within the epithelium is known as buckshot scatter. So basically, first you see cells in nest or clusters arranged in organoid fashion. Then you will see your epithelioid melanocytes in a pegatoid manner, and then you will see pegatoid spread within the epithelium in buckshot scatter. Then you have melanocyte basement membrane dense inflammatory cells are seen. Melanin pigmentation may or may not be present. Then the treatment is surgical excision, regional lymph node dissection if the lymph nodes are involved. Thank you.